In the last 10 years, we have seen significant problems on three main fronts. One is the progress in science and understanding, depth of understanding of cancer, the complexity of cancer, the biology of cancer, and with the number of tools that we have at our disposal to address the needs of cancer. There's no doubt right now that the patients with cancer can be treated better, can expect better outcomes, and generally better survival. However, we have not made as much progress in addressing the inequities between patients who have access to healthcare, to good cancer care, to good diagnosis and good treatment, and those that do not. And that's in spite of the fact that there's been tremendous progress in visibility of cancer on the global agenda. So cancer is more visible within WHO, and it's wonderful to have these three main resolutions on elimination of cervical cancer, taking advantage of the vaccination and screening and treatment, on the childhood cancer initiative, which is wonderfully being implemented across the world and has great potential for changing the perception of cancer as a fatal disease in many, many jurisdictions. And then finally, the initiative on breast cancer being the most common cancer in women around the world. And if we start building infrastructure to address these three projects, we hopefully will benefit many other cancers. However, the progress is very slow. These three initiatives, there's a lot of discussion, there are a lot of guidelines, there are a lot of documents. Scaling up the action requires resources, and resources have not been brought to the table. Where I think we failed is implementation and holding the governments accountable for progress, and holding people accountable for the pace of progress. So I said before that our understanding of cancer and science, a number of tools, whether it's technologies or drugs or surgical interventions that we have, is so much broader. So the gap between what we know and are able to do and what we're doing is actually growing. And that really requires urgent action, because the science is moving forward. We're going to be able to do more and more about cancer. But if we lag behind in implementation, then the gap between what we know and what we're doing is going to grow and disadvantage people. I think we need a change in approach. I think I sit a number of groups, commissions, meetings, discussions, and discussion is, how do we appeal to the decision makers? And we've been using the same approach for the last 20, 30 years. Talk to decision makers. It hasn't worked. I think we need to engage people, and I talk about patients with cancer thinking of current patients that have cancer to access to care, past patients who have had cancer but haven't quite recovered and don't have support and lack of efforts to integrate them back to society. I also talk about future patients. You know, I always think that if I had cancer, I'd like better treatment for myself. If my daughter has cancer, I would like her to have much easier time with diagnosis and treatment and much better outcomes with less suffering. But when I think of my grandchildren, I don't want them to get cancer. I think we need to have three agendas. One is to implement what we do now for people who have cancer, but also to think about the future And the future needs to be more ambitious. We talk about decreasing tobacco by improving taxation and regulation and implementing Framework Convention for tobacco control. I think the future should be no tobacco. There is no reason actually to have tobacco in the world. So I think in many fronts we need to be more ambitious and how we want to see the future with cancer being much less of a health problem than it is today.